Vaccine hesitancy, one of the biggest obstacles the nation is facing in getting the pandemic under control.
For people of color, trauma tied to distrust and past injustices is stopping them from rolling up their sleeves for a COVID shot.
In this special report, TV5's Jamie Sherrod looks at why some in communities of color are hesitant to get the vaccine.
Success is her only option.
Ebony Gibson is a Flint resident and business owner who loves to create content for her brand.
My main passion is helping other small businesses find their purpose.
Pursuing those passions came to a pause back in August when she found out she had COVID.
I started getting symptoms that felt like a cold, and then a few days later it was like, okay, kind of got a loss of smell, kind of got a loss of taste, but I wasn't 100% sure.
Those symptoms soon escalated. She experienced shortness of breath and had difficulty breathing. Ebony says she wasn't vaccinated when she caught the virus. She was hesitant, and she had her reasons why.
When you have those layers of trauma, especially for Flint, you're dealing with multiple layers of distrust. You're dealing with multiple layers of trauma. So the pandemic is another layer of trauma for a Flint resident.
She felt the government had already failed her and other Flint residents.
We not selling out.
When it came to the water crisis.
3, 2, 1.
In 2014, there was a change in the city's water source. Residents were told the water was safe to drink.
Here's the flag. Here it is.
But it was later found the water was contaminated with lead, forcing those who live in the city to depend on bottled water to survive.
You start thinking about, you couldn't trust your government from the water crisis. You can't trust things historically. You take all of that into consideration when you're making a decision.
One of those historical events, the Tuskegee syphilis experiment, conducted from 1932 to 1972 in Macon County, Alabama. According to the Centers for Disease Control and Prevention, the U.S. Public Health Service worked with the Tuskegee Institute on a study to record the natural history of syphilis. It involved 600 black men, more than 300 with syphilis and more than 200 without it, who were told they were being treated for bad blood. Instead, they were monitored by healthcare workers and given placebos. Even when penicillin was named the treatment for syphilis in 1943 and was widely available, the participants in the study were not given the treatment in order to study the progression of the disease untreated.
So people who could have been treated and it could have changed the course of their life and the life of their loved ones and their partners and spouses, instead were not given that treatment.
The unethical experiment resulted in 128 patients dying from the disease or complications of it, 40 of their spouses becoming infected, and 19 of their children acquiring congenital syphilis, haunting people like Ebony Gibson and others in the black community to this day. Although it may not be the only reason many are hesitant to get vaccinated against COVID-19, Dr. Deborah Fur-Holden says it certainly plays a role.
This was served for many people as another example of where the healthcare system failed them.
When you look at vaccination rates in Genesee County, here in our own backyard, you'll see that vaccination rates sort of in the southern part of the county and sort of the edges of the city center of Flint have a higher vaccination rate.
Flint doctor Bobby McCamala has been on the front lines of the pandemic, even going as far as setting up his own vaccination table at community events, educating those who are hesitant. He says the city of Flint, where the population is more than 50% black, only has around a 30% vaccination rate.
Whereas the southern part of the county is bordering on, Oakland County is more like 60-70%.
Although a gap still exists, he says thankfully it's getting smaller.
Right. There was a gap there, and the gap was there probably because of lack of comfort about the vaccination. And whether it's because people are getting more comfortable with it and trusting the science, and honestly, whether it's because they're being forced to do it because they're not going to be able to go to work if they don't, either way, it's contributing to an incremental increase in the vaccination rate.
For me personally, what changed my mind from I'm not getting vaccinated at all to, okay, I may need to get vaccinated is going through the experience myself and then experiencing it enough to know like, man, I could have possibly prevent it.
At one point, Ebony didn't think she'd survive the virus and still experiences symptoms today.
I still have shortness of breath. There's still respiratory issues. So for the most part, just getting back into my energy levels are still kind of low.
But she's glad to be on the other side of it, able to get back to her business and soon vaccinated, despite some doubts.
I am still hesitant, but I know how I felt when I contracted COVID. And then I also understand the responsibility that we have to one another.
In Flint, Jamie Sherrod, WNEM TV5.
According to the latest data from the CDC, communities of color are much more likely to be hospitalized or die as a result of COVID.